Hi guys, my name is Phil Ruddle. This is a video presentation for PE580. The topic is to examine common soccer injury prevention techniques. And I'm interested in this initially because I have a strong passion for soccer and I have been playing my entire life, and I've been a fan of watching the sport as well. Over the years, I've experienced many injuries and a lot of them have reoccurred. I was also interested to find out other common injuries soccer players are getting and see if they are related to me. Then I wanted to research some of the injury prevention techniques to see if there were ways to reduce these injuries from happening in the first place and then to stop them from reoccurring. Um, so, the purpose of this research is to explore preventative exercises and other techniques in order to find the best ways to prevent common injuries with soccer players. Some of these techniques are using dynamic and static stretching, adding post exercises to pre-training, and using a high compliance with the correct dosage of exercises and techniques. The article Practical Research, Planning and Design helped me realize that gaining a better understanding of characteristics on soccer players, on soccer injuries, and prevention techniques may provide insight on ways to prevent common soccer injuries and keep them from reoccurring. So, one injury prevention technique I learned from researching the journal article called Sports Rehabilitation was about two different types of stretching exercises: dynamic and static stretching. Dynamic is a type of movement preparation that involves stretching while moving, while static is a stretch used when stationary. The goal from the article was to prevent injuries in soccer athletes by using these two types of exercises and explore the possible differences of benefits of static and dynamic stretching used together with one group and then with only using static stretching with another group. 10 teams participated in the dynamic stretching, while 10 teams participated in both the dynamic and static stretching pool. There were 20 injuries in only dynamic stretching and 17 injuries in the dynamic and static stretching pool. These results show that there were less players injured when both teams used dynamic and static stretching, and more injuries occurred with players who only used dynamic stretching. Uh, Another article from the Journal of Physiotherapy I researched examined adding a post-training exercise program to a pre-injury prevention program. There are injury prevention exercises athletes can do before practices and games, and also before post-training exercises they can do after the games and practice to reduce injuries. This study focused on that post-training exercises to see if it reduced injury rates with soccer players. The participants included 21 male soccer teams aged 14 and 35 who were randomly selected into an experimental group and a control group, while each group participated by engaging in the pre-training activity for 20 minutes, and the experimental group then engaged in the post-training activities for another 10 minutes. The results reported 26 injuries with the experimental group and 82 from the control group, which these results indicate that how a pre and post training decreased the total number of injuries as well as the incidence of initial injuries significantly more than solely using a pre-training exercise. In another article from Knee Surgery Sports Traumatology I researched, it investigated if an athlete's level of compliance had any effect on injury prevention. Compliance is when someone agrees to a recommended intervention, um, where you take the correct dosage, frequency, and timing of their injury prevention exercise or exercises. There are many injury prevention exercises and research articles, but few athletes comply with their program correctly and consistently, which is why the authors focused on how compliance may affect athletes. The purpose was to sort differences in the compliance of soccer players and find out if a lack of consistency in compliance training programs could alter injury rates. When the results came out, they showed how the group with lower or moderate compliance had a much higher injury rate than the group with high compliance. It concluded that compliance significantly related to injury rates, and the number of days missed from injury prevention also had a high difference in injury rates. So there was a reduction in injury and time loss every time compliance was low. So these results concluded the importance of consistent and proper injury prevention programs. There are a lot of injury um, In summary, there are a lot of injury prevention techniques out there, and this video went over 3 major ones used to prevent common soccer injuries. Statistics showed soccer players were injured less when they used dynamic and static stretching instead of using only static stretching. It also showed how adding a post-training exercise program to a pre-training injury prevention program also decreased overall injury rates with soccer players. Finally, having high compliance with the correct dosage of exercises and techniques significantly reduced injury rates as well. I'm going to apply this information personally as a soccer player who plays every week still by trying out these techniques so I do not get injured in the first place. Then I will use one of the techniques, or all of them, to help prevent an injury I get from reoccurring or getting worse. On a professional level, as a future PE teacher and future coach, I will apply these techniques so I can keep my best players from the team playing instead of being on the bench and sidelines. The technique can also help me keep my students or players from experiencing further damage to an existing injury and for it to reoccur. In terms of future research that could be provided to this topic, literature explores small amounts of data regarding injury prevention of soccer players. More research could be made to strengthen these prevention techniques. More techniques and exercises need to be researched as well because there are more common soccer injuries than that this video and research did not analyze to prevent. These techniques need to be tested with more participants. The data could be attained by using survey research with multiple college soccer teams. The data could be evaluated by using qualitative research called rigorous subjectivity. Finally, quantitative data analysis called descriptive statistics could be used to measure the characteristics from the survey. So, this video concludes that exploring many possible techniques and exercises in injury prevention can provide insight on some of the best ways to prevent common soccer injuries. It can be frustrating for coaches, players, and other athletes and athletic staffs. Other athletic staffs who lose some of their best players due to a common or reoccurring injury. This can be more frustrating when these injuries could have been avoided if the player knew and used the correct injury prevention techniques and exercises. Gaining a better understanding of exercises, techniques, data, experiences, and opinions of injury prevention could eliminate some of the most common injuries in soccer, and soccer players could play to their full potential without constantly being out of action. I really think some of these techniques can work and should be applied to any soccer team or even other sports. I think the more precautions you take, the better chance you have of staying a healthy athlete, and that's what it's all about with injury prevention.